Welcome to the Lead Change podcast. I'm your host, Dr. Mary Mulcahey. I'm an orthopedic sports medicine surgeon with a huge interest in contributing to the growth and development of leaders. On this podcast, we will share stories from physicians in various medical specialties and those in roles that support the advancement of medicine to understand the skills necessary to be an effective leader. We'll celebrate their success and hear about strategies to overcome hurdles. We will also highlight some of the unique challenges faced by women in medicine who are interested in pursuing leadership positions and the importance of mentorship, sponsorship, and allyship in achieving and being successful in those roles. Let's work together, build on shared experiences, learn from those before us, and use these lessons to propel us forward in our career. Let's lead change. Welcome, everyone, to the Lead Change podcast. I am so excited to have Dr. Marcy Faustin on the podcast today. Dr. Faustin earned her medical degree from the University of Chicago Pritzker School of Medicine and completed her family medicine and sports medicine fellowship training at the University of California, San Diego. She's an associate clinical professor at the University of California, Davis, with joint appointments in physical medicine and rehabilitation and family and community medicine. Dr. Faustin serves as co-head team physician and medical director for UC Davis Division I Athletics and as team physician for Sacramento Republic FC, a professional soccer team. She has served as co-head team physician for the USA Gymnastics women's national team, attending major international competitions, including the Tokyo 2020 and Paris 2024 Olympic Games. Her expertise centers on athlete mental health and the biopsychosocial approach to care. Dr. Faustin is deeply engaged in medical education across undergraduate, graduate, and fellowship levels. Her academic interests include relative energy deficiency in sport, injury prevention, and the principle that movement is medicine. A former three-sport high school athlete and Division I track and field athlete at Loyola University Chicago, she remains committed to comprehensive, lifelong athlete care. So Marcy and I have sort of interacted and been connected from afar, and our worlds certainly overlap a lot in sports medicine. But the first time we actually met in person was when Marcy came to Loyola to give grand rounds in the Department of Psychiatry in May of this year. So we have a ton of things in common, of course, with our careers focusing on sports medicine, but we also both ran track in college, with Marcy being a high jumper and I was a long jumper. So Marcy was a fantastic high jumper. So I'm looking forward to having Marcy talk to us about her expertise as a collegiate athlete, how that influenced her career, and really to highlight some of the most important leadership lessons that she has learned from being a team physician and serving in other leadership roles. Well, Marcy, welcome to the podcast.
Mary, thank you so much for having me. I'm excited to be here. I enjoy listening to all the different guests that you have on the podcast. And I will say that you exemplified the leadership because we had never met in person and you only found out the day before I was giving the grand rounds and you still showed up. And right there is leadership. And I was so grateful for that and brings us here today. So I'm just excited to be here with you.
Yeah, my huge pleasure. And that was so exciting. It actually, the chair of the Department of Psychiatry very kindly reached out to me and some of our other sports medicine faculty to let us know that you were coming to give that talk. And I was so excited. And I said, 110, I will be there. I wanted to take advantage of that very rare opportunity to meet you in person, to make that connection. I know we both kind of felt like we were connected already, just with interactions from afar in sports medicine and via social media, but really having that in-person connection finally makes a huge difference. And it meant really a lot to me to have the opportunity to meet you too. So thank you so much. Thanks for coming. Thanks for sharing your expertise. It was a fantastic talk. So before we dive into the details of some of your many leadership positions, can you tell us a little bit about your clinical practice and some of your areas of expertise?
Yes. So I am trained in family medicine and then sports medicine. So primary care sports medicine. Here at UC Davis, I primarily see the general population patients, usually lots of sports medicine patients. I see all ages. I love adolescents, which not most people say, but I love them. And young kids all the way to our geriatric population. We do new musculoskeletal injuries, osteoarthritis, ultrasound diagnosis, ultrasound guided procedures, PRP injections. I do a little bit of family care within some of the patients that I have there. A lot of mental health that I see. And then we have also a sports performance lab. So we run cardiac stress tests, VO2 max testing, things of that nature. And then in my role as co-head team physician for our UC Davis athletes, we have about 650, 700 student athletes. We're Division I. We also have football. And so the premise that my co-team physician, his name is Dr. Kevin Burnham, he's internal medicine sports, and our associate doc is PM&R sports, Dr. Brandon Hasid. And so we take on the premise of taking care of the entire patient. And so we have clinic 5 days a week in the athletic training room. We do all of their mental health. We do all of their illnesses, sickness, chronic conditions, and then also their musculoskeletal care there. Again, doing a lot of ultrasound diagnosis, procedures, things of that nature. And then travel with the football team at the home games, cover basketball, soccer, gymnastics, along with that. And then as an associate clinical professor, then lots of teaching. I do love the teaching and the mentorship. So from the undergraduate interns to the sports medicine fellows across various departments, they come and work with me in the clinic, going and giving lectures, a little bit within research. And one of my passions is just the premise of taking care of that entire person, the biopsychosocial approach, the biology, the psychology, and the sociology, and how, and the social factors, and how all of that impacts the care that we give, no matter what reason that the patient comes in. And mental health is such a big part of that. And it's probably the biggest population that I see when I'm down at athletics with the student athletes.
Yeah, I love that. And there's quite a bit to unpack, even just from that, you talking about your clinical practice. But I think first, for anyone listening who maybe doesn't understand, like family medicine is a unique specialty in that you really take care of patients of all ages, all different problems, like very broad spectrum. Although obviously you have a huge expertise and interest in sports medicine, you still see a very broad range of issues and injuries. So I think that's important for everybody to understand. And I also love that you highlighted kind of the team approach to taking care of like the athletes at UC Davis and mentioning your partner, but how it's so important for all of you guys to work together and to really be taking care of the whole patient and not just, okay, my knee hurts or whatnot. But the mental health aspect I think is huge, absolutely huge. And your talk, of course, that you gave last month focused on that, really highlighted some of those key points. So everybody listening can hear a little bit more. Like, can you just expand on that a little bit, Marcy, like why mental health is so important for our athletes, why it's important to dig into that, and any specific kind of examples you want to share?
Yes, I think that, not even just for athletes, mental health is important for all patients, all human beings. It's a part of who we are, just like our physical health and our mental health, and they go together. And I think for a long time, we thought of them as separate entities, and especially within athletics, that, it was quote unquote weakness to talk about how you're feeling and if you're having a hard time, versus we're really trying to change that narrative and change the stigma behind it, to say that it's actually strength to ask for help, to be vulnerable in what you're experiencing. And that really opens the door for others around you to have space to also share their vulnerable selves and be their authentic self. I think within sports, I think a lot of it started probably with, in the beginning, the big name was Michael Phelps, after the Olympics, being the greatest Olympian of all time, right? Winter, summer, and his struggles with substance use disorder, anxiety, depression, other aspects of his mental health that he's come out to speak so bravely about. And then looking even further to Naomi Osaka, Serena Williams, Simone Biles, Kevin Love, it's going across all sports, not just Olympic sports, but the NFL, the NBA. And really we're seeing that. For me, what I've experienced and what I see is that those at that high level, especially collegiate and higher, physically, they've done it for so many years. Like their body knows how to train, they know how to work hard. And I think the make it or break it for them is their mental health. Can you stick with it? Can you stay persistent within that? Especially when they're in a world filled with social media, filled with hundreds of thousands of millions of people giving you their opinion 24/7, right? And so how do you actually learn how to block yourself out from that noise in that aspect? And it has a huge
Yeah, no, I think you're absolutely right. And it's hard sometimes to ignore that. So I think literally like at these huge competitions or what, I think literally, right, they remove themselves completely from social media and whatnot. Just don't look at any of the message. You don't want to see the good. You certainly don't want to see the bad.
Exactly.
But I think too, you brought up this very important point, right? Yes, we hear about this at these, there's very high level of athletics, Olympic athletes, collegiate athletes, our professional athletes, but that that mental health has a huge impact for all of our patients. And even in the orthopedic literature over the past 10 years, there's been a huge increase in the number of studies that are looking at the impact of psychological factors or mental health on outcomes following surgery. Right. And so anxiety, depression, et cetera. And it has a huge impact. And so even we as orthopedic surgeons, who many would think like, oh, surgeons don't care about that aspect, but we do really, because it has an enormous impact on how patients do ultimately. And we want to do everything we can to help optimize our patients' outcomes. So of course, we're not necessarily treating that side of it, but we make sure that patients and our athletes get help where and whenever needed. And so I think the first part is awareness, which like your talk and other work that you've done, right, really speaks to that. So it's first is just being aware and then understanding like doing whatever we can to help our patients and our athletes get help to be able to address that aspect of their recovery.
Exactly. And I think the other important part is understanding each individual's social factors, right? Just because somebody is a collegiate athlete on scholarship, that does not mean that they can afford food, you know? And so if you're seeing somebody who maybe has relative energy deficiency in sport, and we're talking about nutrition, how do we increase nutrition? Some of them, they can't afford it, right? And so unless we ask the questions, most people are not going to bring that up to you because they're not going to always feel comfortable with that. But it's our job to really make sure that we're asking those questions and we're not making assumptions about people based on what they look like, what they're doing, or however whatever biases we may have about the individual in front of us so we can understand it. You know, a lot of
Yeah.
people have to choose medicine, surgery, physical therapy, or food, or support my family at home. And that goes across all levels. And so just remembering how the rest of the world, their world impacts them.
Yeah, that's critical. And I think we have to ask the questions, right? We are all in
Mhm.
a very important position as either a team physician, as sports medicine physician, as a surgeon. We are in a very important position. We have the opportunity to ask our patients. So we need to ask them. So I think it's really important that you brought that up because we are in a position where we can try to get the help that they need or seek out additional resources. So thank you so much for bringing that up. And switching gears a little bit. So as I mentioned briefly in the introduction, you ran track at Loyola here in
Yeah.
Chicago. And so juggling collegiate athletics and a rigorous course load is a huge challenge, right?
Yes.
But I really think honestly that participating in athletics at that very high level helps lay a very good foundation for
Yes.
leadership, being an excellent
Yes.
leader. And so I wonder from your perspective, Marcy, what do you think? What are some of the most important lessons you learned by participating in collegiate athletics?
It was a blessing and a great opportunity to, you know, have that scholarship in collegiate athletics and to still be pre-med. And like I tell a lot of our even our student athletes, our undergrads, I thought undergraduate was much harder than medical school. I don't know what your thoughts are, but it was nice when medical school when we all did the same thing versus having what felt like two different jobs. And I think one of the biggest lessons that I've learned from collegiate athletics is working as a team and moving as a unit and understanding that you're only as strong as the weakest link or the one that has to grow the most. And so, how do we support that person so that we can all move together? And I think that looks like winning medals, but I also think you have to have success academically. If one of us fails or we don't do as well, then we also have to learn how to process the feeling of failing, right? And then saying, how do I get back up again and get back up and get back up, right? And continue to be able to find that strength and the resilience and the lessons you learn within that, but then to rely on each other. I deeply believe that life is about connections, and that's what brings me most joy in life. And we have to do it together. And there's nothing in life we can do separately. And one of the things my coaching doc and I always say is medicine's humbling. Don't ever do it alone, right? And that is
Yeah,
never worry alone. And
for sure.
that teamwork has translated up to today, up to right now, us doing this together and learning how to be better leaders. That's just the
Yeah.
way the world goes, I think.
Yeah, I think that those are really fantastic points. I think teamwork is enormous, right? That is what you learn on whatever sport you're playing, right? Some
Exactly.
people may say like, "Oh, well, track is a pretty individual sport," but it's not. It's like yes, you're competing in an individual event, but
Hmm.
you are working together as a team to achieve a
Hmm.
shared goal.
Hmm.
So yes, I think teamwork is huge. And the resilience, that aspect is critical, right? Learning how to like, we're going to fail. We're all going to experience that. You have to experience that. But it's like you were saying, it's how you respond to that, how you react, what you learn from it, and how that helps kind of carry you forward, right? Those lessons are
Yeah.
critical.
Yeah.
And then the whole aspect too, load the boat, right? That's the load the boat. You
Yeah.
have a team physician, get everybody on board. What do you think about this? Like have
Exactly.
you had an experience with this type of issue or this condition? Like how did how did you respond? How did you treat the patient or athlete in that case? We all learn from each other. I agree with that completely. Every single day we are learning from each other, right? From our practice
Exactly.
partners, from our colleagues, around the country, around the world. Like that's a huge opportunity and a huge advantage is to be able to share everyone's knowledge, right? And our patients all benefit from that.
Exactly. And I think it's important to even think of it outside of just physicians, our athletic trainers, the nurses, the medical assistant, you know, everybody who touches a patient is a part of the team and everybody has a different perspective that they can bring in so that we can just take the best care we can of our patients.
Yes, absolutely. And our physical therapists, our athletic trainers, our coaches all have
Phenomenal.
different areas of expertise,
Exactly.
but it's the collective knowledge
Exactly.
and what really is what provides the best care for the athletes. And all members of the team share the same goal. So absolutely, like, and there are regular meetings and everybody's talking about what should we do, how can we optimize care, and that's critical because they know a lot of things that we don't know. And so
Exactly.
it's really critical to get everyone's expertise and to encourage them to share their opinion. So really,
Mhm.
really important. So you previously served as co-head team physician for USA Gymnastics women's
Yeah.
national team. And in that role, as I mentioned, you accompanied them to major international events,
Mhm.
including the 2020 and 2024 Olympics. So congratulations. What an
Thank you.
incredible experience and incredible role. And so can you explain to us a little bit about how that opportunity came to be and what were some of your main responsibilities in that role?
Uh, I started volunteering actually with one of the docs who worked with USA Gymnastics to try to get in the door. And then when I was a fellow, my attending said, sure, you can go work these regional competitions of gymnastics that were all over California, and they would help cover me. And so that's how I started getting that experience. And the more I was exposed to those individuals working within USA Gymnastics, the more they mentored me, kind of taught me the way in that aspect. And then in 2019, Dr. Ellen Casey, who I know you've had as a guest, and I worked together during that time period. And so it was an incredible experience. I've learned more about the importance of trust, the importance of communication, transparency, the administrative side of medicine that you don't really learn in training or in fellowship, but being in COVID and traveling nationally or being a medical director for a competition nationally or internationally, and how do we work with all of these COVID protocols in the different states and in those different aspects. And so it was fun to use my brain in a different way that I didn't even know was possible because I hadn't really seen it modeled for myself. But it was a great partnership that we had. And it was, to watch those gymnasts accomplish their goals, that's what we love in medicine as a whole, right? Whether you're an Olympian or you're our patient and you can walk and you can go to your child's wedding and you feel good, like you just want to watch people overcome. And that is beautiful.
Yeah, that is really incredible. And having a role, having, opportunity to
Hmm.
contribute to their care or
Hmm.
prevent injuries, right? It's a really
Hmm.
unique opportunity that we have in sports medicine. And that certainly you had at that very, very high level. And you touched a little bit on maybe some of the lessons you learned, but I would love for you to expand on the communication aspect. So how did you guys effectively communicate as a very large team? You have all these members, you have the physicians, you have the physical therapists, the athletic trainers, the coaches, the athletes, the parents. But so really, what are some ways that you found to most effectively communicate at that very, very high level of competition?
I think number one, over communication. When you think it might be enough or you're being annoying, you just keep going and you pull in all of the key players for that one individual. And it can't just be who we think are the key players, but you have to ask the athlete themselves who's important to you, who's on your team, who do you want us to involve to be part of the conversation of the decision making of how we're going to move forward. And so a lot of phone calls, a lot of text messaging. If you're away at competition, trying to really get the parent, guardian, whoever that significant other person was, on the phone. And I'm a big proponent, even in the clinic, of everybody come in and hear the same story together, And so we can get on a call and have coach, parent, athlete. If we need high performance in there, the physical therapist, athletic trainer, like everybody in one conversation so that we can bring all of the brains together and then we can decide what is the best course moving forward. So a lot of over communication. And I think one of the other big aspects that I learned through the process is just that I think when I went through training, it was almost shown to you like the patient should trust you. You're the physician, so they should trust what you're saying. They should trust your advice. They should just do what you say because you said it. But that is not reality. And trust goes both ways. It has to. It
Yeah.
has to. And so, really, they have to trust me, but I also have to trust them. Right. And that's the only way we can make it work. And trust is just gained by experiences together and showing up consistently and being honest and saying, I'm sorry and admitting to mistakes when you've made a mistake. We're human. We're going to make them and just really moving forward together. And so I think that the trust and the communication really came in key during all of those years.
Yeah, such important points. And one, over communicating, but actually that's never a negative thing. It's impossible to,
Yeah.
like you were saying, it's impossible really to ever over communicate. Just make sure everyone is aware of what's happening. And absolutely critical that you said, ask the athlete or even just our patients in general,
Hmm.
ask them who is important to you to be involved in this conversation. I love that. And I really have not heard anyone say that. So I think it's really critical to take that away, that we should involve everyone who's important to that athlete or that patient and make sure everyone's on the same page. Do they want to call someone while we're in the room together? Do we want to send an email? Do they want us to have a phone conversation after the fact? Like, ask them that. And so that is really absolutely critical. And then the whole part of trust, okay? Trust and establishing that trust. As you said it so eloquently, it is about being around, being
Hmm.
available, having a presence, having them, the coaches, the athletes start to
Hmm.
see you there, see that you care and trust you so that when something happens, I mean, something's going to happen. It's the nature of what we do, whether it's
Hmm.
gymnastics or other sports, but then you already have that relationship. And I think that is fundamental to what we do. So for me, I'm covering basketball, loyal, right? I go to the games, I'll go to practices sometimes if I
Exactly.
can, I'll meet with the coaches, right? You're doing all of that before, and hopefully there's never an injury, but at least
Exactly.
you have that relationship and that foundation. And so I really, really love that you brought that point up. I think it's so
I
important.
think it's really critical. And that's what I even tell the fellow and the residents. Communication has to just be direct. The more you can do in person, the better you are, when things do go awry, and they will, because that's medicine.
Right, exactly. And so absolutely anytime we can do this in person, that is really critical because you can't replicate that Zoom or over the phone. You can't replicate the
Exactly.
in-person interactions. But of course, if that's not a option, having at least a phone conversation or some other way to be
Exactly.
connected directly is really important.
Exactly.
So you currently serve as co-head team physician and medical director for UC Davis Division 1 intercollegiate athletics, as we touched on. I wonder for you, can you highlight just some of the main differences in that role compared to serving as co-head team physician for USA Gymnastics?
I would say there are probably more similarities in the roles than differences. Although, probably one of the biggest differences is that at UC Davis, we have 15 athletic trainers who are under our jurisdiction as the team physicians. And so, really coordinating a much larger team to function to take care of a much larger number of athletes with a variety of sports, from field hockey to lacrosse to equestrian to football. And how do we all bring together our strengths and learn from each other from these various sports? Part of the reasons that I love doing athletics is because I see all of the athletes and I love learning about all the different sports, the different injuries they get, but then they always have the good hacks of like, what do you do when this happens? Things you just don't even think about. And that's how you learn so much from our patients in that respect. And I think it's a little bit different with gymnastics in that when you travel with the team, as you know, I mean, you're with them 24/7, for a week, weeks on end. And that's a very different environment, which is also really fun for me to just get to know people on a different level, not just the athletes, but the coaches, the parents, the high performance team. And you just learn different aspects when you're eating all your meals together. And that's really fun to do. But I think the basis of it is just establishing those relationships and establishing the trust. And for those athletes and the team to know, if you've got an issue, I'm here for you and I'm here to support you. And my job is to keep you safe. I feel like I
Yeah.
say this a lot. My job is to keep you safe now and for the future. And so that is my number one priority. And I know your number one priority is to play. And so how are we going to mirror those things?
Right, absolutely. And sometimes that puts us in a challenging position,
Yeah,
but such great points, and I think an interesting contrast, right? Where obviously there are some similarities to your general role and responsibility, but at the collegiate level, right, you're covering all the sports. So really
exactly.
important point. But you learn so much, and I think that's great. You may learn something from the basketball players that you can then use to help the field hockey players or the
Exactly.
football players or whatnot. So it's great to have that sort of transfer where you're helping them and with the ultimate goal, as you said, we're just trying to keep everybody safe, keep you safe, healthy, and looking at kind of the long term, right? Living a very happy and functional life for as long as possible. Have there been any, specific initiatives that you've been able to help implement in your role at UC Davis?
We've done a lot of policies and procedures that we've written that goes to the university to make sure that all of that aligns with NCAA. And one of the big initiatives that we had going back to this biopsychosocial approach is that we wanted to have monthly meetings with our mental health team. So the team physicians, our psychiatrists at student health, the sports psychologists, sometimes the eating disorder specialists, sometimes the other types of psychologists that are through student health, that we all come together and we run the list of our highest risk athletes. And even, for example, if our psychiatrist isn't seeing them, he's providing his input as a psychiatrist of what we could be doing to help support them. So that's been really great. And then on top of that, we've also added a monthly meeting to talk about our athletes who have relative energy deficiency in sports, or the female athlete triad. So really looking at the nutritionists, adding them in along with the sports psychologists, and then the team physicians. And if we need to, our athletic trainers, whoever's there, so that we can run the list and we can all communicate for our higher risk athletes. And we can all, again, hear the same story and say, what is it that we can be doing? Because as you know, when we're just reading each other's notes, so much is missed, right? So much is missed in that. And so this, I think, has offered us a great opportunity to better care for those athletes and just to keep them safe.
Yeah, yeah. And that's so critical, is having those meetings. I think that's great that you guys do that and you have monthly meetings, monthly check-ins. You're not just relying on notes. I mean, notes are great. It's better than obviously having nothing, but
Yes.
it's, you still don't get the same level of detail. You don't have the
Mhm.
interaction, and it's like not a dynamic sort of approach to taking
Exactly.
care of the patient. So really, really critical to have those meetings. So I'm so glad that you guys are doing that regularly. And then for the getting nutritionists input too on the separate kind of
Exactly.
relative energy deficiency and sport type of issues. So just bottom line is, it's really important to have all of the experts involved contributing their
Exactly.
expertise and their input, so that then
Mhm.
collectively as a team you guys can make the best decision for the patient. So I think that critical, and that is way more productive and beneficial for the patient than to try to have decisions made independently or with disjointed, I guess.
Exactly.
Yeah,
Exactly.
yeah. So you've served in several very important leadership roles, Marcy, with both within and outside of your institution, and you're incredibly highly involved with teaching and mentoring. And we're going to dive into that a little bit more as we move through the conversation. But I wonder for you, Marcy, what is your purpose and motivation in all that you do, and what is it that really drives you and gets you out of bed in the morning?
Relationships. I love people. I love connection. I love relationships. I love it with my husband, my family, my friends. But what's drawn me to medicine and what keeps me going are the relationships with my patients. I love my patients. And to be able, I think it is a blessing and a rare opportunity for others to come and see us and share with them their deepest secrets that they don't even tell their husband, their mother, their father, their best friend. And we are allowed and given that space to hold for them. And I think we just, in the busyness of clinic and being a physician and seeing so many patients and insurance and the things that are so frustrating about taking care of patients, but I think really to stop and remember what we're doing. And it's amazing to care for others and to allow people to live their best quality of life. Not what I think it is what I've also learned through the process is, sure, I want you to do this, but if they don't want that, then it doesn't matter. So what is important to you? And I think as physicians, our job is to hold hope for our patients.
Yeah, yeah, that's it's so true and such a great point. I think those relationships, it's a rare opportunity. Like we have a huge privilege to
Hmm.
have these interactions, as you were saying, and the things that are shared, and the sort of confident. I mean, these information is kept in confidence, but
Hmm.
it's shared with the goal of, right, trying to help the patients get better, help them get back to doing the things they want to do, give them hope that they can do X, Y, or Z. Some people may say, how can you develop these relationships? You have to see all these patients. It doesn't take long, right? If you
No.
even just asking people too, well, what do you do for work, or what do you like to do outside of
Yes.
work, or what grade are you in, or where do you go to high school? What sports do you play? Little things like that. And probably you do this too. I'll make little notes and just say like, oh, this patient is in such and such a high school. They're
Sure.
sophomore and excited about the spring soccer season or whatnot. And then you ask the patients about those things at subsequent visits, right? I think it's really critical. I'm so glad you brought that up. I think it's a unique part of medicine. It's a privilege that we have the opportunity to do that, and it's an important part of taking care of patients.
Exactly. And what I say to learners all the time, what do people say? What do they get frustrated about this health system or our family members? The doctor didn't listen to me. The doctor didn't listen to me. No one talks about the doctor wasn't smart. The doctor didn't order the tests. The doctor didn't listen to me. So our job is to listen to them and to validate their experience and then to support them. And after some time, it makes it exciting instead of just cranking through the day.
Yeah. Yeah, you're absolutely right. And then we get to hear about so much and have a lot of different
Learn so
experiences.
much.
Right,
Exactly.
right, right. Exactly. So you are very involved with mentoring at all levels of education, including high school students, medical students, residents, fellows, colleagues. So can you share a little bit with everyone listening, why is mentoring so important in medicine in general? And what are some of the things do you think that can be done on both the part of the mentor and the mentee to really have a very effective mentoring relationship?
Goodness, I always start with the story of Dr. Neeru Jayanthi, who was my team physician while I was at Loyola as a track athlete. And I asked him what he did. And he said, come with me. And he took me to the hospital, to the clinic, to the resident teaching. And he was a family and sports medicine doctor. And that is how I decided that is what I'm going to do with my life. And because of the significant impact he has had on my life, I believe in the importance of reaching our hand back and bringing somebody else forward and helping to answer those questions, and the importance of you've got to be able to see it, right? To believe it. And so I want to be there to help support others to go after whatever dream it may be that they think maybe they can't do it. But if you can just give people that little bit of push, then that's what's important. The mentors, I think, gosh, I've been surrounded by so many great ones. And one of the biggest lessons I've learned from them is one, Dr. Tanji, sometimes he'll say, no, Marcy, I don't think you're ready for that. And you're like, what? Why not? And then later I'll say, oh, I've got this opportunity. I don't think I'm ready. And he'll say, yes, you are, and then I believe him because I know he's not going to put me in a situation. And so I'm like, oh no, I'm stuck. I have to do this. But that's the goal, right? To push you and to help you gain that confidence within yourself so that you can step outside of the box, right? And take on new opportunities. And when things don't go well, those are the first people I call and say, I need help. This is what went wrong. Here's what I think. What do I do next? And so they're there for the good times and they're there to support you and help guide you in that path. And I think it's important to reach back to those mentors, right? And say, hey, I made it into medical school. Hey, I'm doing this right now, because we love to hear about it and we love to hear about your success in that way. And I think the relationship goes both ways.
Yeah, you're absolutely right. It's critical. It really is critical to medicine. I mean, I think it definitely applies to other areas, other careers, but definitely absolutely critical to medicine. And for all the reasons that you stated, and I love that too. The idea of let your mentors know too. What are you
Yeah,
doing? What came out of whatever the discussion was? Where are you now in your
exactly.
life and career? Because
Mhm.
certainly, like the mentors want to hear that.
Exactly.
And because it's you feel grateful, I'm sure, when your mentees reach out to you and say, "Oh, Dr. Faustin, I, did this thing, or I'm in med school now, or I'm
Eh,
in residency." And so you're really proud. Like
so
mentors are
fun.
proud of mentees' success. That's what you want. Ultimately, like we all want mentees to be more successful than we are in
Exactly.
our own careers. And so I think that that's fantastic. Such a great point. Like I love to hear the story. So I agree with you completely. Throughout your career, you've worked with a lot of leaders, right? Within, UC
Mhm,
Davis and USA
mhm.
Gymnastics and in other roles through sports medicine. So can you describe for us some of the lessons you've learned from leaders that you really admire? And what would you describe as the factors that make them great leaders?
I think the first factor I would say for the leaders that have been phenomenal around me are they listen, and they're really listening when people are speaking to them, and they allow people to kind of go through their story or whatever they may be asking for or sharing or need, and then also responding to them, appropriately. It's not like when somebody says, "Hey, how are you? Hey, how are you?" No one's really looking for that answer, but they stop and say, "Let me look at you and let me see how I can help support you." And I think also they say, "I don't know," right? When they don't have an answer, they don't know what that answer is, they can help get you to that answer. They're sponsors when you're not in the room. They're the ones that elevate your name. They elevate what you're able to do and put you in spaces to allow you to be successful. And I think they have a level of authenticity to who they are. The mentors I think about are varying personalities, but they are who they are. And I think the way that they can move through medicine, through life with all of the external pressures and still stay true to themselves, I think that is inspiring to me versus just trying to be in a position of trying to continue to climb, and whatever that may look like. If that makes sense.
Yeah, yeah, that's fantastic. And I think that the point that you made too about just listening, like really listening,
Mhm,
giving the opportunity to whatever a group, whether it's one on one or a bigger group or a
mhm.
committee or a division or a department, that you give everyone the opportunity to speak and contribute and that you listen, like without trying to sort of interject and take everyone's points into consideration.
Mhm.
So I think that's such a great point. And being authentic. So 100% as individuals, as leaders, and certainly other leaders that we work with, like having that authenticity, being yourself, like being true to
Mhm.
yourself and really
Mhm.
showing up as yourself is essential to connecting with your team too. And obviously there's, there are things you're going to do at home on the weekend at the barbecue that you're not going to
Exactly.
do like in your department meeting, on Wednesday morning. But like the bottom line is like, is just being true to yourself, being appropriate in the setting, but just all never trying to be someone that you're not. So I think that is such a great point to bring up. And you really connect so much better with people when you are like being true to who you are and your values. So fantastic that you brought up that point. So switching gears a little bit, I love to ask this question because I am always curious about the response. So for you, Marcy, what would you define as your superpower? Meaning truly, what is one of your biggest strengths that contributes to your success and truly sets you apart from others?
My coaching doc says my superpower is that patients and people always cry with me. No matter what they come in for, everyone always knows to have Kleenex in my patient rooms or if someone's coming, which I actually take it as a positive and that people feel
Yes.
safe with me. And I'm here for it. I'm here to support people. And I think the other thing that my husband would also say is I can get people motivated to start reaching for their goals. Like really good at just motivating people to just take just a baby step and get moving. And so it brings me joy when people come back and they say, guess what I was able to do? And they can prove to themselves their own greatness.
Yeah, love that. Those are fantastic superpowers. Like, just like put the tissues in. Dr. Faustin's in clinic today. Patients feel comfortable. They want to
Mhm,
share. They're willing to get vulnerable. And I think too, as a
mhm,
physician, like to some level, right? You're willing to get vulnerable with them too, and so they
mhm.
make that connection. And just the sort of your other superpower of being inspirational and motivating. And the key point there is to just take a step, right? Do something, take an action, move forward, right? You may not accomplish that huge goal tomorrow, but
Mhm.
like you were highlighting, just taking a step and doing something brings you that much closer to achieving that goal. And I
Yeah.
agree completely. You are hugely inspiring and motivating, and so it's a fantastic ability that you have is to inspire others.
Thank you. Thank you. I appreciate it.
So, a few questions rounding out our incredible discussion, Marcy, but a few questions I really like to ask everyone. So, first for you, this podcast is lead change. And I wonder, what does lead change mean to you?
Lead change is how we should all be living our lives, but I don't think of it as you have to be a medical director or this high level position, but I think we lead change every day. We lead change with our family, our friends, our patients, our colleagues, just to be kind, and give others a reason to, smile. And I think that in itself allows people to feel change.
Yeah, that's fantastic, right? That we all are in a position, even just as physicians, but just individuals in our life and how you're functioning and how you interact with others who are around you, that you have that opportunity to lead change, to inspire, to motivate people.
Mhm.
And that it doesn't require some, it's not just at the
No,
highest level that you can
exactly.
inspire and encourage that. So I think that that's a really critical point is that everyone, all the, the position, what you're doing, the interactions you have every day can also serve to accomplish that.
That
So
exactly.
really critical. Have you read any leadership books, Marcy, that you have found particularly impactful or influential to you, or even any other resources related to leadership that you have found to be beneficial?
The person I listen to a lot is Brene Brown. I did read parts of Atlas of the Heart and listen to her podcast along with Adam Grant, who do a lot of the sociology leadership. I recently realized I used to listen a lot to like medical podcasts or learning things when I was in the car or running. But now I've switched it to I like learning about leadership in spaces outside of medicine. So another podcast I listen to is The Diary of a CEO by Stephen Bartlett. And so he'll have physicians, but also professors, CIA agents, Secret Service, just all different types of people in different realms of life. And I really enjoy learning from others who are not in medicine and in their own space and how that really, all of it translates, but it's a different perspective to hear it from a business side point of view. And so that's
Yeah.
what I really enjoy.
Yeah, that is an excellent point. So, I mean, one, just highlighting in general, podcasts are a tremendous resource to learn about leadership, to learn about other aspects. But Also, I love that you brought up about learning about leadership from areas outside of medicine. I think that's
Hmm.
critical. Like, that is such a great point, and learning from business or other areas. Like,
Hmm.
obviously there are some things that are that translate, most of it translates, but it's a totally different perspective. And in many of these other careers, whether it's in business or military aspect, like a lot of
Exactly.
my friends in orthopedics and sports medicine are in the military, and they have a lot of leadership training, and I've learned so much from them. So I think that's
Hmm.
also a great area to learn. But bottom line is like that we shouldn't be so limited or feel limited and be focused only on medicine or things that are tied to medicine. So
Exactly.
so great that you brought that up. I'm gonna file that away because I'm gonna check out that podcast too. I really
Really
enjoy
good.
listening to podcasts. So my last question for you is, do you have any favorite quotes?
Yes, it is be kind, for everyone you meet is fighting their own battle. And when I was a sophomore in high school, my coach, Coach McCall, who I still, speaking of mentors, who I still communicate with, she made me a photo album and she put that was the first page and she put that quote in there. And I think of it every single day.
Yeah, that's fantastic. I actually have not heard that quote. So
Yeah.
thank you so much for sharing. And it goes back
Yeah.
to your high school coach. Like, that's incredible what an impact that's had
Yeah.
on you and your life, and continues to obviously inspire and motivate you. So Marcy, thank you so much for being on the podcast. I feel like I could just talk to you easily for another hour or more. So it has been a fantastic conversation. And I know that everyone listening will be inspired and motivated to pursue their goals. So thank you so much for sharing some of the many valuable leadership lessons that you've learned throughout your career. Good luck with everything. You have a lot on the horizon. You have the CrossFit Games coming up this
Yeah.
summer too, which we talked about briefly before we started the podcast, but so many great things happening. And I really hope that our paths will cross again soon.
Thank you, Mary. And thank you for leading change with this podcast and with everything that you do. It's a privilege to be here. So thank you.
Thank you so much. And we'll definitely see each other soon. So take care.
Yeah.